With all of that housekeeping out of the way, I'm finally very pleased to welcome you all this morning to what promises to be a terrific conversation. My name is Alec Crawford, and I'm a Senior Policy Advisor with the NAP Global Network Secretariat, which, as some of you know, is hosted by the International Institute for Sustainable Development, or IISD. The NAP Global Network itself is an initiative that works to enhance national adaptation planning and action in developing countries and help accelerate adaptation efforts around the world. The network now connects, amazingly to us, over 1,300 individual participants from more than 150 countries and has delivered direct technical support to 45 countries. Funding for the network has been generously provided by the governments of Germany, the United States, Canada, and Austria. We're very happy to have organized this webinar today in collaboration with our colleagues at the World Health Organization and Women Deliver. For those of you who are new to the NAP process, we wanted to take a few minutes just to introduce the process to you. We recognize that some of you are coming from the health sphere, from the gender sphere, and the NAP process may be new to you. So for those of you, the NAP process was established in 2010 under the United Nations Framework Convention on Climate Change, and its importance was reiterated under the Paris Agreement. It's a strategic process that enables countries to identify and address their medium and long-term priorities for adapting to climate change. It's led by governments, national governments. It's very much a country-owned process. And the process itself involves analyzing both current and future climate change and assessing a country's vulnerability to its impacts. This provides a basis for identifying and prioritizing adaptation options, then implementing these options, and crucially, tracking your progress and results. Importantly, the NAP process puts in place systems and capacities needed to make adaptation an integral part of a country's development planning, decision-making, and budgeting. So it's again crucial that adaptation is integrated across national development plans and ensuring that it's an ongoing practice rather than a separate ad hoc exercise. This isn't just a document that's going to sit on a shelf. This is very much a process that continues over time. It can be thought of as including three broad phases: the planning phase, as you can see in this figure, the implementation phase, and then monitoring and evaluation, all of which are supported by enabling factors: capacity building, financing, appropriate institutional arrangements, and information sharing among the different actors involved. We're going to kick things off this morning or this afternoon or this evening, wherever you are, with a panel discussion. We're very lucky to have three speakers joining us today to talk about the recent analysis of NAP processes and how they integrate health, gender equality, and sexual and reproductive health and rights. Our first speaker will be Amy Savage. Amy works with the Climate Change and Health Unit of the World Health Organization. She provides country support and capacity building on a range of activities to build climate resilient health and health systems. Amy has developed technical guidance and training materials on climate change and health, including quality criteria for health national adaptation plans, which was published this year. Angie Daze is a senior policy advisor and gender equality lead for the resilience team at IISD. She co-leads the NAP Global Network's work on gender, and she's been working at the nexus of gender and climate change for more than 15 years now. She's authored a number of research and guidance documents, including global assessments of progress on gender responsive adaptation planning and a toolkit for gender responsive NAP processes. And finally, Divya Matthew, who serves as Director of Policy and Advocacy at Women Deliver. Divya joined Women Deliver in February 2019 as their Senior Manager for Research Policy and Advocacy. And in this role, Divya leads the organization's portfolio for the evidence base and investment case for gender equality and sexual and reproductive health and rights, or Srhr, as you'll be hearing it called. We're very lucky to have the three of you with us today. Amy, Angie, and Divya will first be providing some brief presentations focusing on the findings of the different analyses, and then we'll be able to get deeper into the recommendations during the Q&A following the presentation. Amy, we're going to start with you. I'm going to pass the floor on to you for your presentation. Thanks very much.
Thanks so much, Alex, for that kind introduction. So today I'll be presenting some of the key findings of a review of health in NAPs, which will be published next week by WHO, IISD, and the NAP Global Network. Next slide, please. It can be hard for health ministries to understand the practical steps they need to take to protect health from the wide range of climate risks affecting all parts of the health system. We want to mainstream climate without distracting from core health systems business. So we've developed a simple framework just on the left of this slide that builds on the 6 core building blocks of health systems and identifies how to build climate resilience into each of these. Many countries and technical partners use this tool to structure their health adaptation planning, including the health component of National Adaptation Plans, along with climate and health programs and interventions. The map on the right of this slide shows that 57 countries have requested support on climate change and health to WHO. And just to note, this doesn't include the 35 member states in the Americas. Next slide. We conducted a review to assess the degree to which health is considered in national adaptation plans. We reviewed NAPs submitted to the UNFCCC NAP Central Portal, which was a total of 19 NAPs by December 2020. And we focused on the context sections of the NAPs and the specific health chapters. I'll now share 6 high-level findings of the review. Next slide. First, all NAPs identify health as a priority sector for climate risk and climate change adaptation. Most of the NAPs have a separate health chapter. The exceptions are those that are not structured around sectors. Next slide. All of the NAPs consider a range of climate-sensitive health risks, and if you could just bring up the graph, which we grouped into the categories you can see in this graph. Vector-borne and waterborne diseases are the most commonly mentioned climate-sensitive health risks, and all NAPs consider these. Next slide, next graph. Malaria and dengue were the most common vector-borne diseases, while diarrheal diseases and cholera were the most common waterborne diseases. Next graph. The health impacts of extreme weather events, such as injury and mortality, were also often mentioned. The health risks least considered are zoonoses and mental health. Next slide. We found that there are some gaps between the climate-sensitive health risks identified in the NAPs and specific adaptation actions to address them. So the blue bars are the numbers of NAPs that mention this category of health risk, and the orange bars are the number of NAPs that have at least one action that specifically targets that risk. For example, while all of the NAPs mention waterborne or water-related health impacts, just over half included at least one adaptation action in the health chapter related to these risks. And 16 of the 19 NAPs mention malnutrition and foodborne diseases as a key climate-sensitive health risk, but only 6 specify related adaptation actions in the health chapter. On the other hand, many health actions are targeted at system strengthening and are applicable to a wide range of climate-sensitive health risks. And of course, there may be actions that address these risks to some extent in other chapters, such as water resources and agriculture. Next slide. Along with looking at climate-sensitive health risks, we mapped the adaptation actions in the health chapters to the 10 key areas outlined by WHO that I mentioned at the beginning of the presentation. This mapping exercise showed that many of the NAPs address several aspects of building a climate-resilient health system. We can see that 17 of the 19 NAPs included actions related to integrated risk monitoring and early warning for health, and 16 NAPs prioritized actions related to the health workforce. Other areas, such as management of environmental determinants of health and climate and health financing, were the least often prioritized in the NAPs. Although NAPs included adaptation actions addressing one or more of these components of a climate resilient health system, they often lacked a comprehensive programmatic approach. That is, the inclusion of a broad range of actions needed to build climate resilient health systems. Next slide. Most NAPs identify adaptation actions in other sectors that will have benefits for health. For example, adaptation actions to address the risk of food insecurity and malnutrition as a result of droughts and flooding were sometimes incorporated in the agriculture chapter. This highlights the importance of a coordinated cross-sectoral approach to NAP development. Next slide. And finally, only 6 NAPs identify specific target groups for health adaptation actions. Some of these target groups include rural populations, low-income groups, youth, people with disabilities, and women. Only 4 NAPs apply a gender lens to the adaptation actions for the health sector. And I'll now hand over to Angie, who will elaborate further on gender considerations in NAPs.
Thanks so much, Amy, and good morning, afternoon, and evening, everyone. So I'm just going to share a few key findings from the NAP Global Network's latest synthesis report on integrating gender considerations in NAP processes. Next slide, please. This was our second global synthesis report. The first was released in 2018. And in this second report, we assessed progress between 2018 and 2020 on a few key aspects of gender responsive approaches in NAP processes. We based the assessment on three key sources. The first was a systematic review of the 18 NAP documents that were available on NAP Central at that time. We also reviewed a sample of 35 proposals for NAP readiness funding from the Green Climate Fund, or the GCF. And finally, we incorporated information that we gained through documentation and monitoring of our engagement with country NAP processes through the NAP Global Network. Next slide, please. So the first thing I want to highlight is that we are seeing progress. We see countries are making an effort to integrate gender considerations in their NAP processes. All of the NAP documents, except one, mention gender, and we saw an increase from 89% to 94% from 2018 to 2020. So what this means is that all of the new documents that were submitted since the first report include references to gender. Similarly, we found that all of the GCF NAP readiness proposals that we reviewed, with only one exception, include an overarching commitment to gender equality. And this is really important because this readiness funding from the GCF really represents a significant investment in NAP processes over the coming years. So having this commitment to gender equality is a very positive development. Next slide, please. One area where we've seen significant progress is in the positioning of women in NAP documents. So what we saw in the documents in 2018 was that women were most often positioned as a particularly vulnerable group and or as beneficiaries of adaptation actions. In 2020, we saw more of the documents recognizing women as a distinct stakeholder group in adaptation planning processes. We also saw that a number of the documents explicitly recognize women's leadership in adaptation. For example, the NAP document from St. Vincent and the Grenadines highlights the need to harness the leadership of both women and men throughout adaptation planning, budgeting, and implementation. And this is really positive, we think, in terms of moving on from this vulnerability framing of gender and climate change issues towards recognition that women in all of their diversity are agents of change in adaptation and resilience building. Next, please. The next area where we're seeing good progress is in the use of gender analysis to inform adaptation planning. In 2018, we saw limited evidence in NAP documents that context-specific gender analysis have been used. By 2020, a number of countries had undertaken targeted gender analyses to inform their NAP processes. And we're seeing this happening at different points. So for example, Madagascar did a gender analysis during the formulation phase of their NAP document and incorporated the recommendations in the document. Ethiopia, on the other hand, already had a NAP document and they used it to inform their implementation strategy. And Kiribati was undertaking an update to their NAP document and they used the gender analysis to inform that update. So what this shows is that there's value in doing gender analysis all throughout the NAP process, regardless where a country is. And looking forward, we see that more than half of the GCF proposals include activities related to gender analysis and or the use of sex disaggregated data. And gender analysis is really the foundation for gender responsive approaches. So this is definitely something we want to see more of, and countries can learn from the experiences of their peers who have already gone through this process. Next, please. One area where we're seeing less progress is in the establishment of platforms for sustained stakeholder engagement in NAP processes. So we do see a greater proportion of the NAP documents indicating that women participated in the planning, but we're unfortunately not seeing a lot of evidence that sustainable platforms for this engagement are being put in place. And similarly, the review of GCF proposals found that fewer than half included activities related to gender equitable stakeholder engagement. Given how important gender equitable participation is in terms of a gender responsive approach, this is something that needs more attention going forward. please. The establishment of institutional arrangements for adaptation is really an essential step in NAP processes, but we're not seeing these mechanisms being set up in ways that take gender into consideration. Less than half of the NAP documents that we reviewed present evidence that gender was considered in the institutional arrangements, and only a third of the GCF proposals indicate activities that address gender in this area. That said, many of the GCF proposals do include gender expertise as part of the project team, which is positive, but it's not clear how this will be institutionalized once the projects are completed. As NAP processes move forward, it's going to be really important to establish mechanisms that facilitate the ongoing collaboration among gender and climate change actors, and also that countries track, report, and improve on gender equity in institutional arrangements for adaptation over time. I'll stop there and hand over to Divya. Thank you very much.
Thanks, Angie. Good morning, good evening, good afternoon. My presentation will focus on the findings of the joint report by NAP Global Network and Women Deliver that explores the extent to which NAP processes consider the linkages between climate change adaptation and sexual and reproductive health and rights, or SRHR. Next slide, please. In terms of the rationale, there's evidence that shows that climate change, sexual and reproductive health and rights, and gender equality are all interconnected. So climate change impacts an individual's SRHR. You might have seen that climate-related disasters, it disrupts access to services. We also see negative maternal health outcomes, as well as an increase in gender-based violence. Additionally, if a community enjoys SRHR access, they become more resilient to climate change shocks and stresses, as well as their ability to participate in climate solutions increase. We'd encourage you to go onto our website. We've recently launched an evidence review that explores these linkages in depth. Next slide. In terms of the methodology for our exercise, we looked at three kinds of documents. One is the NAP Global documents that was formally submitted to the UNFCCC as of the end of last year, as well as a select sample of health sector NAPs and climate readiness proposals submitted to the GCF. The slide describes the framework that we undertook in terms of the aspects of SRHR covered, and this includes gender-based violence, to maternal and newborn health, to access to contraception. Next slide, please. In terms of the findings, the first two findings of the report really align with what Amy and Angie were talking about. One is that we see that all NAP documents prioritize health for adaptation. And two, while we aren't seeing systematic gender considerations or analysis of gender considerations, there are references to gender when it relates to health. When you drill down to SRHR, we're seeing limited references in these NAP documents. The most commonly cited issue relates to pregnancy and newborn care and the vulnerability for these stages of life. So for example, the Brazil NAP document recognizes the vulnerability of pregnant women in the event of droughts and floods. And the second most cited issue was gender-based violence, especially as it relates to disaster. So the Suriname NAP document calls for the training of GBV volunteers when it comes to disasters. Next slide, please. From our initial review, we're seeing there's a bit of a disconnect between the health sector NAPs and the overarching NAP document when it comes to SRHR. So we may find specific actions for SRHR in the NAP, in the health sector NAP, but that's not reflected in the overarching NAP document. And I'm happy to talk about examples later on in this session. Next slide, please. We find that there are opportunities to bring SRHR to the forefront of discussions. The most logical entry point is through efforts to increase gender responsive approaches to climate action. So for example, when you undertake vulnerability assessments, you could add a gender and SRHR lens to ensure that adaptation actions link to efforts to promote SRHR and avoid unintended negative impacts. It's really important to underscore that vulnerability assessments should take into consideration groups that are often overlooked and marginalized, like people living with HIV/AIDS or people from diverse genders and sexual orientations. Next slide, please. We also find that investments in health sector adaptation provides indirect benefits to SRHR. So although the majority of our documents don't have specific SRHR related actions, there are a number of actions related to the health that provide indirect benefits that are mentioned. So for example, investments in health facilities and infrastructure to improve the resilience of the health system to shocks and climate stresses, in turn reduces the negative impacts of climate change on SRHR. Planning for disasters become an important component of this, so to ensure that SRHR services are provided both during and after a crisis. Next slide. And finally, we find that finance for adaptation and health really falls short. So there are a number of NAP documents that have references to costing of implementation of adaptation actions, but often details behind these costs are missing. This becomes really crucial, especially as we need to sort of invest in strengthening the health systems for resilience in the wake of COVID, which has shown that there are strong gendered impacts from the pandemic and shows the weaknesses in the health system. I'll stop there and look forward to discussing some of the policy recommendations during the moderated Q&A. Thanks. Over to you, Alex.
Thanks so much, Divya. And thanks to all three of you for those presentations. That was hugely interesting. And I think that it's encouraging to see progress in some areas, but clearly more needs to be done, much more needs to be done. We're now going to have a brief discussion with our three panelists, followed by Q&A. So I would encourage everyone on the line to continue to submit questions to the chat on the Zoom platform, and we'll try to get to those once we've had this brief panel discussion. Amy, I'm going to start with you. In addition to the overarching NAP document, some countries are developing specific adaptation plans for their health sectors. What opportunities do you see that these present for building climate resilient health systems?
Thanks, Alex. That's a good question, because I think that health national adaptation plans, or health NAPs, do present considerable opportunities for building a climate resilient health system and protecting population health in the face of climate change. So we've found that in many cases, the health sector has prioritized the development of a climate change and health plan before the NAP processes have been established. And there's a tendency to keep the NAPs short for obvious reasons. But since the results of the review showed that the detail in the NAPs is often not presented as a programmatic approach to building a climate resilient health system, we recommend that a HNAP is also developed, which allows a more detailed plan for the health sector than is usually included in the overarching NAPs. In some cases, and this is something that Divya touched on, there's a challenge in the health sector to ensure that the HNAP is well integrated in the NAP. And this is really important. And so ongoing health sector engagement in that process is very important. I'll just give one quick example. Fiji's NAP is structured around sectors, one of which is health. And Fiji also has a HNAP, which was developed before the overarching NAP because the health sector had identified climate change as a critical priority before the NAP processes were established. In this case, the HNAP provided a strong base for health sector engagement in NAP processes. It ensured that the health sector priorities were clear and adaptation actions from the HNAP were included in the NAP. But at the same time, the HNAP still remains useful as it's a much more detailed plan for the health sector. And finally, a HNAP also provides an opportunity for further cross-sectoral collaboration and to integrate actions from other sectors such as WASH and agriculture. So for example, the HNAPs developed by Tanzania, Ethiopia, Bangladesh, and Nepal all involved input from other sectors in the development of the plans and include actions related to health determining sectors such as the development of climate resilient water safety plans, for example. Thanks, Alec.
That's great. Yeah, and I find that most of the countries that I work with on NAPs, I'm seeing more and more focus on health, and I think that will only accelerate with the pandemic, I'm assuming. Divya, over to you. You mentioned that on the subject of these health NAPs, they may do a better job of integrating SRHR issues than the overarching NAP document. Could you provide some examples for us on how these documents address SRHR, excuse me? And how do you think these issues could be better reflected in the overarching NAP documents going forward?
Sure. Maybe I can give two examples. One to piggyback on Amy. The Fiji Health Sector NAP, and as it relates to SRHR, discusses a declaration, so the Kaila Pacific Voice for Action on Agenda 2030, that aims to strengthen climate resilience through maternal and newborn and adolescent health. And it's really ambitious in the sense of it calls for increased access to SRHR services for girls and young women, increased access to contraception services, and eliminating all forms of GBV in a rights-based approach. But we haven't found details as to how this declaration has been implemented. And for example, it's not referenced in the Fiji NAP document. Another example is Ethiopia. So the Ethiopian NAP sector document for health recognizes that GBV may increase as an impact for climate change. And it also recognizes that family planning could be one of the intervention areas, citing population pressure on climate sensitive natural resources. It's not very clear whether this is done in a rights-based approach, but also it's not reflected in the overarching NAP document. So how do you address for this disconnect? One way is to strengthen the coordination between the different agencies that handle the NAP processes, gender, health, and SRHR, through the setup of institutional coordination mechanisms. Angie had referred to that there's still work to be done in this area, but when you get the right set of actors together, they can commonly identify what the challenges are and how do you address these challenges. A second way is to look at the existing guidance that is on health and gender for NAPs and seeing if there are entry points into SRHR. So for example, WHO has guidance on adaptation in the health sector, and the NAP Global Network and UNFCCC has a toolkit to guide countries on how to do gender response approaches to climate action. So while they don't address SRHR specifically, it does give you a framework to consider some of these issues if it's supported by analysis, data, and evidence. The consequence of this is that as countries are advancing in their NAP processes, they're looking at elaborating implementation strategies and developing funding proposals. So there are additional opportunities to make these connections that might not be originally in a NAP document. Thanks.
Thanks so much, Divya. And I think that really highlights nicely the iterative nature of the NAP process. It's not a kind of one and done thing. It continues to evolve over time. Angie, I'm going to switch over to you. So more and more countries are doing targeted gender analysis to inform their NAPs and their NAP processes. Do you think this presents an opportunity to better address SRHR and other health aspects?
Yes, I mean, absolutely. I think as soon as you start moving into a deeper analysis of gender issues, health issues in general and SRHR in particular are going to come up. Just to give a couple of examples, in Togo's gender analysis for their NAP process, the risk of malaria for pregnant women was highlighted, and the analysis calls for targeted training for health personnel to better address the specific needs of people of different genders. In Madagascar, They did a sort of a sector-based gender analysis, and the analysis for the water sector noted the need to consider women's health issues in water and sanitation projects in order to remove barriers for women and girls in employment and education. So these are just a couple of examples, and deeper analysis is needed, but I think that they highlight how important gender analysis can be in surfacing some of these issues of concern that may not have been considered otherwise, and also making the links between gender issues across the different sectors. And I think as more and more countries undertake these analyses, we're building a stronger and more nuanced evidence base on the linkages between gender equality and climate resilience and health issues, including SRHR. And this provides a basis for integrated approaches that address some of the deeper structural issues that impede realization of rights and that make systems, including health systems, less resilient.
Thanks so much, Angie. Amy, I'm gonna pass back to you now. The analysis of NAP documents emphasize the disconnect between the climate-sensitive health risks identified and the specific actions that are designed to address them. So how do you think that this could be better addressed in future iterations of NAPs? How can they move more from, again, identification of the risks towards actions and implementation?
Thanks, Alec. Well, I think in general, we approach health adaptation planning from a systems-based perspective. So while the review did find gaps between the climate-sensitive health risks mentioned in the NAPs and specific related actions, the NAPs did also often include actions that are applicable to a wide range of climate-sensitive health risks. So for example, almost all the NAPs included actions related to integrating climate and weather data in the health surveillance system, which is useful for a range of climate-sensitive diseases. In Grenada, for example, one recommendation of their Vulnerability and Adaptation Assessment, or the VNA, was that the country's health surveillance system could be strengthened. And so one of the measures included in the NAP was to develop an integrated health system that was to enable forecasting and outbreak monitoring. But we did find that there wasn't always a reference to a VNA assessment in the NAPs. And as we know, one of the initial steps of developing a NAP is to conduct a VNA. And these should include health. A VNA can identify the priority climate-sensitive health risks and then inform the health chapter. But again, just to reiterate, although it's important to address the specific climate-sensitive health risks, adaptation actions should also be considered within a health systems approach to ensure that the actions lead to a more resilient health system. Thanks.
Thanks very much, Amy. Angie, you've emphasized that progress is being made on integrating gender considerations into NAP processes. Obviously wonderful, more work needs to be done. Where do you think that additional investments are needed to maintain this momentum? How can those investments be kind of best targeted to get the momentum continuing to grow?
Yeah, I mean, I do think we've seen a great deal of progress in the last couple of years, and that the momentum is really building, especially with the adoption of the Enhanced Gender Action Plan at COP25. That's given another boost to the idea that climate action needs to be gender responsive. With respect to NAP processes, I'll just highlight 3 areas where I think we need additional investments in the coming years. The first is capacity development. So though we're seeing important steps forward being taken, there are still considerable capacity gaps that are limiting gender responsive approaches. So we need to invest in capacities of both adaptation actors and gender actors, including at the grassroots level, for the meaningful engagement that is needed for NAP processes to be gender responsive. The second thing I'll highlight is vertical integration. So as countries are advancing their NAP processes, we see that local actors are increasingly implicated in implementing adaptation actions on the ground. And so we need to strengthen the linkages between the local and the national levels to ensure that decision-making is inclusive and that it's informed by local realities, and also that these national plans create an enabling environment for gender responsive adaptation at subnational levels. And the third piece will probably not surprise anyone, gender responsive adaptation finance. So we're seeing increased attention to gender issues at the proposal stage for international climate finance mechanisms. And I highlighted a number of examples from the GCF NAP readiness proposals. But we need to ensure that these commitments are carried through implementation and monitoring and evaluation. And I think we also need more attention to gender in domestic budgets for adaptation, as well as investments by the private sector. And I think that this piece of really looking at gender responsive finance throughout the whole ecosystem of adaptation finance is really the only way we can ensure that these investments yield gender equitable benefits.
Sounds easy, Angie, what you've laid out. So, no, obviously very complex systems that that have to be addressed, and there's certainly an impetus to do that. Divya, I'm gonna go to you for the final one before opening it up to the participants. What role do you see for gender equality and SRHR advocates in that process as we move forward?
To have these kinds of conversations we're having today, it's so important to bring the climate and health and women's rights advocacy communities together. If we have a dedicated network of actors that are focusing on the linkages of climate and SRHR, it really enhances dialogue and coordination and approaches to NAP processes. Maybe I can give three ways. One is, Angie was referring to really generating and analyzing and disseminating the evidence on the linkages. So when we were doing our evidence review exercise, we really found that a lot of the conversation was related to maternal health or gender-based violence and less on other aspects of SRHR, like infertility. It's also important to sort of approach the evidence with an intersectional lens. So, how are different groups being impacted by climate change, whether people living with disabilities or people living with HIV/AIDS. The second way is through the stakeholder engagements, very rightfully so. Angie mentioned, and I've seen in chat, that women are really agents of change. And so how do you engage advocates in stakeholder engagements for the NAP process throughout the project cycle, from planning to implementation to monitoring and evaluation? And then the last is, how do we influence existing platforms like the UNFCCC Women and Gender Constituency, but also policy windows. So this year we are, the Generation Equality Forum is really a milestone for the gender equality movement, and climate and SRHR are key themes, but we really aren't seeing the linkages there. So how, as we as advocates, can really push and call for attention when it comes to NAPs. So these are just a few ways.
Thanks so much, Divya. We are getting a lot of questions in the chat, which is wonderful. I think that we have a very engaged audience today. I'm going to try to direct them to the right person, but if you're not the right person, please pass them off to one of your colleagues. I'll start with a couple of questions, one to Amy and one to you, Divya, and they're kind of about just more information for the participants. So to Amy, Kamal Jumue had the question, excellent presentation. How are climate sensitive health risks regionally distributed? For example, is Africa the most affected? And then for Divya, we had a question from Brigitte Gubadi, who said, do we have any data on the link between gender-based violence and climate change? So if you could offer just a bit more background information maybe on those links, that'd be great. We'll start with you, Amy.
Thanks. Was it Kamal? Thanks, Kamal, for the question. Yeah. Climate sensitive health risks are going to affect every country and every region, but there will be differences among the countries and among regions. So I wouldn't say that Africa is necessarily more affected at base level, but there will be differences in regions. So that's why I think that a VNA, a context-specific VNA, is really important at the beginning of developing a NAP, so that you can identify those climate-sensitive health risks specific to your country or perhaps region, depending on the level of data that you have. Yeah, thanks.
Thanks, Amy. Over to you, Divya, on gender-based violence.
Yes, the short answers go to our website for our evidence review, but we do see cases of gender-based violence in the aftermath of disasters. So for example, in Myanmar, after Cyclone Nargis, the incidences of sex workers increased. We also see that, because they face financial hardships, people are compelled to force children into early child marriage, which is a form of gender-based violence. So there's lots of different examples that are out there that I'm happy to share details about that.
Thanks so much. We had some interesting comments on Togo. It seems as though Togo now has both a specific guide on gender for the general NAP and an annex on gender for the health NAP, which is very encouraging, and that there's also health included in the NAP document itself and a health-specific NAP within Togo. So lots of progress there by the sounds of it. Thank you, Alina Berenson, for that comment. I had a comment from Balkrishna Kurvi, who said, who's wondering about cancer awareness and detection as being a component within the NAPs. So I'm not sure if Amy, you could speak to that at all. And then a second question, probably best fielded by you, Amy, was to what extent does the climate crisis influence zoonotic diseases like Lassa fever in the tropics? That is from Victor Okiri from Nigeria. So one question on cancer and one question on zoonotics. I know zoonotics you touched on briefly in your presentation, but maybe a bit more detail would be great.
Thanks, Alec. In regards to cancer, we didn't see a lot of countries mention that in their NAPs. Depending on the type of cancer, it could be a climate-sensitive health risk, again, depending on the country. So, for example, melanoma, skin cancer could become an even bigger problem in places like Australia as temperatures rise. But if that's what comes out of the VNA, if that is a climate-sensitive health risk for your country, it's definitely something that should be included in the Health National Adaptation Plan. The same with cancers that are related to diet, perhaps in the long term, as climate change affects food production, affects diets, could contribute to cancer. So again, it depends on your VNA and whether or not that is a climate-sensitive health risk for your country, but it is a possibility. There are some links. And zoonotic diseases, I'm not an expert on zoonoses, but there is definitely links between climate change and zoonoses. It does depend again on which disease it is and which region it is. But for example, changing rainfall or changing temperatures changes the hospitable habitat for certain animals that may be carrying zoonotic diseases, and could also perhaps lead to more human-animal contact if climate change induces migration and there's density in urban areas. There's a lot of information out there. There's some on our website, so I definitely recommend that you look into that a little bit more if that's a climate-sensitive health risk for your country.
Thanks very much, Amy. I have a question from Mariana Castano-Cano for all panelists. So maybe I'll start with you, Angie, if that's okay. And then Divya and Amy, you can jump in with your thoughts. The COP president, Alok Sharma, has recently recognized that adaptation is the poor cousin of mitigation. Looking at your studies, one may see that gender-responsive adaptation is the poorest of all cousins. Are you hopeful that the recent Climate Adaptation Summit and different leaders' statements on adaptation is a good sign? Do you see a shift in the narrative in favor of bringing adaptation forward in the climate discussions and public-private institutions' climate plans? Big question, Angie. But I'm gonna pick on you first.
Yes, I mean, I think that, some of us have been working on adaptation for quite a long time, and we've been feeling this sense of neglect over the years. But I would say that I'm an optimist, and I've never felt more that the momentum is there. So having a global goal on adaptation sitting at the same level as the mitigation goal in the Paris Agreement is a huge win. And I think since then, we've just seen the dialogue moving forward. And I think that, yes, then we're trying to apply gender responsive approaches to this challenge of adaptation. And that's just adding a whole other layer of complexity. But again, I'm seeing more and more recognition that this this is just fundamental to how we need to approach this if we want adaptation to be effective. And I think, you know, the whole narrative around leaving no one behind in relation to the SDGs is also really pushing this agenda of, you know, equity and inclusion across all of these processes. So I feel like, as I said, there is a lot of momentum, and I think that we see things happening in terms of guidance and commitments and statements. And as Divya mentioned, Generation Equality has an action area around feminist action for climate justice. So there's a lot happening right now. So I've never felt more optimistic about moving this agenda of gender responsive adaptation forward.
Anything to add to that, Amy or Divya?
I think Angie said it all really well.
We did have a comment about the kind of window for opportunity that COVID has presented. Laura Rotimi says, even before COVID-19, all North and South countries were off track in achieving the SDGs by 2030. COVID-19 has presented a short window of opportunity to build back better, build back greener, and recover better, but that it's rapidly closing. Do you see that the pandemic has kind of lent a sense of urgency to addressing these issues, or has it instead sucked a lot of the oxygen out of the room? Any kind of thoughts on how we put this within the context of the pandemic?
I think the pandemic has definitely led some momentum. WHO did publish a manifesto for healthier recovery from COVID-19 that lays out some prescriptions. And I'll put a link to that in the chat. So I'm, like Angie, probably optimistic, but I do think that the pandemic has really put some of this into focus, and the urgency of climate change has come to the forefront a little more as well.
I would agree with Amy. I think there's never been a time where the overlapping crises is really coming to fore, and there's a lot of attention to building back better, building back greener. You know, how do you invest in strengthening the resilience of health systems that will address both, you know, COVID as well, the shortcomings from health services, but as well as climate change. So definitely an opportunity to combine forces, but also to merge different forms of financing to address these different objectives.
Thanks very much, Divya.
And just to
Angie?
add to that,
Yeah.
I think that what we're seeing is that, you know, all of the work that has been done on adaptation planning, which is obviously focused on sort of building resilience, and NAPs are trying to look at this at a more systemic level. I think that what we're seeing is that we can learn a lot, and there's a lot there to build on towards building these more resilient systems. And so we see some of our country partners really, you know, looking to their NAPs to say, okay, these are some of the things that we need to put in place if we're going to manage risks better going forward, whether those are climate risks or health risks.
Perfect. We had a comment from Katri Kavioja, who says, I'm wondering about further supportive action that could be taken to ensure that women, and indeed people of all genders, are not only framed as vulnerable groups, but are also truly engaged as active agents of change. What role can the UN and development partners play to create space for and amplify the voices of all women, including those marginalized due to sexual orientation, gender identity, ability, minority status, and other factors? Who is a massive, massive challenge, but I'd love to get the ideas of you all on that. Who would like to start? I'll pick on one of you if I have to.
I can go. I mean, I think that we're beginning to see the conversation about gender move on from just being about women and just being about women as a vulnerable group. As I mentioned, we're seeing this shift in sort of positioning in the NAP documents. That's just one small indicator, but I think it is an indicator that the conversation is moving on. And I think certainly with respect to the participation piece, we have framed this as being central to a gender responsive approach. So we recently worked with the Adaptation Committee and the Least Developed Countries Expert Group under the UNFCCC to develop a toolkit for gender responsive NAP processes. And the way we framed it is, there are really three things we need to look at. One is that people have different needs and capacities for adaptation related to gender, depending on their gender. The second piece, which is central, is this piece around gender equitable participation and influence in decision making. And then the third is looking at gender equitable benefits. So I think that this issue of participation remains central to the conversation. It's an ongoing challenge, but it's something that we absolutely need to tackle at all levels, from household, community, up to the UNFCCC negotiations. And it is something that's being tracked and monitored in the negotiations. And there is a big push through the Gender Action Plan to ensure more equitable participation.
Just plus one to Angie. There's so much momentum on looking at these issues from an intersectional approach. So not just, women don't have just one identity. There are multiple identity that aggravates discrimination. So it's important, sort of at the political level, through these declarations, to highlight the importance of looking at it through an intersectional lens. But on the practical level, I do think funding is needed for capacity building, for outreach, to get these stakeholders involved. We're relatively new in the climate space, and find it's such a technical conversation that tends to happen. And so sort of how do you build the bridges with these communities to understand the language is also crucial.
Thanks very much, Divya. On that question of language, and I'm not sure if you want to take this, or Angie, if you want to jump in, or Amy, of course. We had a question from Aisha Constable. In the temporal analysis of gender integration in NAPs, have you observed a shift in how it's framed? How is their framing of gender over time, as well as efforts to move NAPs beyond gender sensitive to gender responsive to gender integration? How is that language kind of evolving with time? And are there any concrete examples of frameworks or methodologies that are successfully used in NAPs to assess or to conduct gender analyses? Angie, do you want to go? Angie's smiling, so I'll give it to you, Angie.
There's a lot there. On the language in the NAP documents, I think what we've observed is that it's sort of implied that countries are interpreting gender as being about women. Often, a commitment to gender sensitivity or gender responsiveness or integrating gender, it's framed in different ways, is stated, but it's not really unpacked as to what's meant by that. So I think this is an ongoing challenge, and it's certainly something that, we're working with countries to sort of help them unpack what they mean by we're going to take a gender responsive approach to our NAP process. Regarding gender sensitive to gender responsive, I think that, the shift in language under the UNFCCC, so we have seen the more recent decisions refer to gender responsive. I think that's really sort of leading the way for countries to say, okay, this is the approach that we want to take. But then, as I said, it's about understanding then what does that actually mean in practice, and that's something that's a bit of an ongoing challenge. But I think, as I said, we're seeing progress. And in relation to gender analysis, I think every country is unique in terms of both where they're at in their NAP process or whatever policy process they might want to apply the gender analysis in, and also in the context. So I think what we've found is that there are some big questions to be answered, both looking at the institutional aspects, what are the policy and institutional dynamics in a particular country, and then also the issues on the ground around climate change in different sectors across different systems. And so I think, a tailored approach is really important, but we have shared some lessons on gender analysis. We can share that the link in the chat. And it's something that, you know, we're working on with a number of countries, and I think we're generating lessons all the time and trying to share as much as possible, both the results of the analyses and the process that we're going through.
Thanks so much, Angie. I think that it's encouraging, and it's good to remember that despite the fact that these are, you know, absolutely enormous challenges, there are resources out there. There are, you know, supporting players and NGOs and CSOs that can help both governments and other stakeholders that are struggling with these issues move in the right direction. There's a lot out there that can help, again, establish and maintain that momentum. Divya, did you have anything to add before I go to the next question? You can just shake your head if you don't. My next one was from Maria Carmona, who had a question about participation. How can the NAP process to tackle intersecting issues of climate change, gender equality, and health be made more participatory? So for example, where agency and decision-making power is shared with those affected the most. Maybe I can ask Amy. Amy, do you want to jump in on that question of participation from what you've seen maybe in the development of health NAPs, for example? How have they been done well when it comes to a participative process for getting that health NAP developed?
Thanks for the question, Alec. I'm not sure I have the right experience to answer that one from an experience point of view. Obviously, participation is important, and I think it depends on the country how that's approached. Probably Angie or Divya has a little bit more to share on that.
Angie, do you want to jump in?
Sure. I mean, I think this is an ongoing challenge, and it's not unique to adaptation in the sense that, you know, national policy processes, we all agree that they should be participatory and inclusive and gender balanced. But the practicalities of doing that are really difficult and complex. You know, consultation, meaningful engagement of stakeholders takes time, it takes resources, it takes skills, and often, you know, these things are in short supply, particularly time and resources as countries are trying to move these processes forward. And so I think it's an ongoing challenge, and one that, you know, we need to keep emphasizing, and also emphasizing that there are opportunities throughout the process. Divya mentioned earlier, you know, it's not just at the planning stage, and it's not just at writing a proposal stage. We need to be building in these mechanisms for participation throughout all of these processes, and sort of maintaining the focus on that as an essential piece of these initiatives being successful.
Thanks very much, Angie. We had a question from Khadija El Houdi from Morocco. And this, I think, links to the question of monitoring and evaluation in particular, but are there any indicators that are being used to measure the link between adaptation and gender equality and health? So on the question of indicators, how are we measuring the progress on these three areas? Any ideas?
I can make a quick intervention from the health perspective.
Yeah.
I'm not sure that I can think off the top of my head of any indicators measuring all three, but WHO does conduct a global survey to develop country profiles, which does measure some indicators of health progress in climate change adaptation. So I can also put a link to that. And there's a few indicators in leadership and other indicators that are included in that survey. So that's one way that we monitor global progress and at a country level. But I'm not sure about any indicators linking all three, though.
Thanks, Amy. We are, I notice, 5 minutes away from the close, and I would be remiss as a moderator if I didn't close on time and give you all back the remainder of your evening or morning or afternoon. I have one last question to the panelists that you can each take kind of 30 seconds to respond to before I'll say some closing statements. But my question to you then, to wrap up this discussion, is what is one key step that you'd like to see countries take to ensure a more integrated approach to addressing health, gender equality, SRHR, and climate resilience. Divya, I'm going to start with you if that's okay.
Sure. I would say policy alignment. So how would you ensure that NAP processes link to broader gender and health policies and plans? We haven't seen specific examples of alignment of NAPs with SRHR specific policies, but the links to SDGs and other gender and health policies provide a potential opening for this. So how would you use existing analysis on gender-based violence or access to SRHR services to inform your adaptation planning? And so this is really crucial for policy coherence.
Thanks, Divya. Amy, over to you.
I think one of the key entry points for gender responsive HNAPs is to conduct a gender analysis within the VNA assessment. So it's important during the VNA to gather sex disaggregated data and if possible age disaggregated data and explore the social norms, roles and relations of different population groups, determine the exposures and then develop the responses to target those more exposed or more vulnerable to that specific health risk. So vector-borne diseases, malnutrition, heat stress. And this applies to all health programs, including sexual and reproductive health and rights.
Thanks, Amy. Angie, over to you.
Well, I completely agree with what both Divya and Amy have said. And I guess what I would add, and it sort of links to the last question, is to consider these issues in monitoring, evaluation, and learning systems for adaptation. You know, this is about a lot more than just indicators. It's about what data is collected, how that data is disaggregated, as Amy just pointed to, how it's analyzed, importantly. And I think, if we're taking integrated approaches, we also need integrated tracking so that we're mapping the linkages between different outcomes, considering who's benefiting from the investments and how, why, or why not, and promoting learning about what works and what doesn't. And I think, we're seeing that more and more countries are working on establishing monitoring, evaluation, and learning systems for adaptation. And we want them to be practical and be able to be operationalized, but also we don't want to see that they're oversimplified and missing these important connections. And this is where I think participatory approaches are really important so that we ensure that we go beyond the numbers and understand how change is really happening on the ground. And this is essential from my point of view to avoid that we inadvertently exacerbate inequalities or vulnerabilities, or that we reinforce some of these existing silos between the different approaches. And I'll stop there.
Thanks so much, Angie. And yeah, I think that's, those are very clear, inspiring, essentially a roadmap for where we can take this next and continue this momentum building toward where we need to get to. I'm going to close the session at that. I'd like to thank our three experts, our three panelists, for sharing their insights. It was wonderful to hear from you all. It's inspiring to see the work that you're doing, both together and apart. And I think this really helps move us again in the direction that we need to go to ensure that both health and gender considerations are integrated into adaptation planning. I'd like to also thank all who contributed to organizing the session. Thank you for bearing with us on slight technical hiccups at the beginning of the session. But thank you to the rest of the organizing team and to the interpreters, of course. As mentioned, the recording of the webinar and the slides will be available shortly on the NAP Global Network website. So please feel free to share it with any of your colleagues or friends. We will send an email with links when it is posted. This will also include links to the reports that were presented by the panelists, so we'll be getting you that background information if you need it. Before we close, I would like to invite you to join the NAP Global Network by registering on our website at napglobalnetwork.org. This is free, it's open to anyone, and it can be done on an individual basis as well. It doesn't have to be for your institution. By joining, we will be sure to keep you up to date on future webinars, publications, and knowledge products, as well as NAP-related news more broadly. Please, again, don't hesitate to be in touch with us if you have any questions or are interested in learning more about how you can get involved. I know from the chat, we had a very rich set of questions coming through and comments coming through, so there's a lot of appetite for this topic and for more information on it. So please don't hesitate to get in touch. And again, thank you all so much for joining us today. Our sincere thanks to our partners at the WHO and Women Deliver for their collaboration on both this webinar and on knowledge products over the last few months. It's just been an honor and a pleasure. I think I can speak from Angie's perspective, working with you both. Stay well, everyone. Take care, and we look forward to seeing you at our next event. Thanks a lot.